And myasthenia is one of those diseases where parts of the body attacks itself. It's an autoimmune disease, and the body makes antibodies against the place where the nerve communicates with the muscle, the skeletal muscle. And as a result of this disease, people have weakness in their arms and legs, sometimes their neck. They have weakness in their eyes, like a drooping of their eyelids or double vision. And they can have weakness in their throat with difficulty speaking, swallowing, and chewing. And the tricky part about this disease is that the weakness fluctuates, meaning they can be really perfectly fine for a while, and then they get very weak. The patients have reduced endurance. So most patients who have myasthenia gravis, as I've said, make antibodies, and 85% of those with generalized myasthenia, meaning affecting the eyes, the throat, the arms and legs, most of those patients have antibody against the acetylcholine receptor. This is a part on the muscle fiber, a membrane that accepts the signal, which is acetylcholine, from the nerve. So there's a receptor for this signal, and the antibody is against that receptor in most cases and blocks that activation of the muscle. That's how they get weak. There are multiple mechanisms by which the acetylcholine receptor interferes with that receptor. There can be other antibodies, such as the MuSK antibody, musculoskeletal, and also LRP4, so MuSK and LRP4 antibodies. And there's some people where we are unable to measure antibodies, but they still respond to therapy and have the other typical features. So we call those seronegative. So this is an antibody-driven autoimmune disease. And this new medication is an Fc receptor inhibitor. So what is that? Well, our antibodies, our immunoglobulins, are recycled in our body. They are taken up by cells, and they are hooked into the Fc receptor and delivered back into the circulation. So that prolongs the length of time that they float around. If you block that mechanism by inhibiting that Fc receptor, then the antibodies, they go to a part of the membrane, the lysosome, where they're destroyed. They're broken down. And that drops the level of immunoglobulins or antibodies in the blood. It drops the abnormal ones, and it drops the normal immunoglobulins that we make. And we call this similar to plasma exchange, which is, we call it a chemical plex, plasma exchange, where we wash out, in that system, we wash out the abnormal antibodies. And in this system, we drop the abnormal antibodies to different levels depending on the Fc receptor inhibitor. So it blocks recycling, and therefore the levels in the circulation drop, and therefore there are fewer antibodies to go and attack the receptor.